hospitals and healthcare has changed so dramatically over the years. Most hospitals were built 100 years ago, where inpatient stays were a lot longer. You needed a lot of beds. You needed a lot of separate skill sets that you all brought together in this big complex. In smaller communities, and Niagara County is somewhat more rural, with some urban areas, but somewhat more rural, you just don't have the influx of patients to have all of that in one place. It's just not sustainable. So we took a look at what the need really was in the community, and the need was primary care and access to specialist physicians and APPs. It was also very clear that this community, and Niagara County is so vast, they needed an emergency department up here. You can't take all the emergencies and go to Erie County. Or the county's so vast, as I said before, you can't go from one side to the other very quickly. This community needed an emergency department. But it didn't need a 100-bed hospital. So our major focus was the physician offices and an emergency department. And then, as you know, as we've walked around, you've seen, we've got a vast area that's 30-some exam rooms for the physicians, and then we'll get into the emergency department. But in the center, you've got all the support services. So we've got imaging and laboratory and blood draw, and that's all in one place. And I think that that's what we've also talked about, that you don't have to come into a physician office, get a script for your blood draw, and then go somewhere else. You can have it done right here.